Well, here we are. It's the end of season 2, and this is episode 12. And we've decided that we want to ask you a question and challenge you. So the question is this: do you believe what you think? So that's what we're going to talk about today. And Chris came up with this, and I'm totally all in. So we're going to talk about the 3 concepts of faulty thinking. And while you may think this is way off base for psychiatry and sleep medicine, it's not, because as clinicians, we're faced with faulty thinking on our own behalf.
Yes.
And with our colleagues and what we believe to be true. And also faulty thinking when we're interacting with patients. And so it's a really important thing to acknowledge and then talk about, and more importantly, to discuss with the general audience so that they can understand more subtle things in the nature of the relationship with a physician or healthcare provider.
Around making treatment decisions.
Yeah, exactly.
Yeah.
And just the relationship, I think.
Yes.
You know, the nature of the relationship. So what's the word of the day?
It is KIDA.
Okay, tell me more.
KIDA is a Hebrew word for bow. And the teacher says KIDA, and the students bow towards the teacher, and the teacher bows towards the students. And it's a sign of respect for who you are learning together with.
Okay, so it's a shared experience,
Absolutely.
not one way.
Exactly.
Which in our day, it was one way.
Yes.
Yeah.
And we've adapted over time.
Right.
And the other reason I chose that for the word of the day, KIDA, is Thomas KIDA wrote the book, which changed my life many years ago, where he was pointing out the don't believe everything you think, the 6 basic mistakes of thinking. And
I want to hear about these 6 basic mistakes of thinking.
All right.
Please, before you go any further, I'm excited. You got to get your notes out.
I do. Okay. So
don't make any mistakes.
I'll do my best.
Okay.
We prefer stories to statistics.
Okay.
We seek to confirm. We rarely appreciate the role of coincidence.
Okay.
We can misperceive the world.
So let me go back. Coincidence in terms of the actual outcome. In other words, this could just have happened coincidentally.
Exactly. And that creates uncertainty.
Right.
Understandably, these are adaptive ways of thinking.
Okay.
But it is also something to take into account. And I've always believed you take it into account to have an open mind.
And what's the last one then of the 6?
Well, there's actually 3 more. We can misperceive the world.
Okay.
We oversimplify.
Right.
And we have faulty memories.
Okay. Yes, right. The eyewitness is rarely a reliable source of evidence. Right.
You know, an example of that would be I would see a patient, and that patient had a terrible experience with, let's say, a medication, and so I would dismiss using that medication because of that experience, and yet there was all these previous experiences that went well, or the evidence suggests that yes, that could happen, but it's unlikely.
And my experience is this: if I see a patient who says, "Doc, the drug didn't work," I'd never accept that.
Okay.
I always challenge it.
Okay.
Because I need the facts.
Right.
To determine for sure, was it the drug Or was it something else
Yes.
that caused the reason
Yes.
they stopped it or whatever? And I do that for myself,
Yes.
but I also do it for the patient so
Yes.
that they can learn.
Yes.
Because they immediately assume something that could be false.
Yes.
This is really fun. I like this episode.
Okay, yeah. I mean, it could be a dosage. You know, it
Totally.
could be.
That's the most common
so many
thing in my
factors.
practice
Yes.
is the
yes.
dose just isn't right.
Yes. Yes. Exactly.
And it didn't work. Well, let's just talk about
Yeah.
that.
Sometimes it's less. Sometimes it's more.
Right, exactly.
Okay.
Oh, this is fun.
Okay.
Okay, next.
So that's it. We're only going to cover 3 of them because
Okay.
this is a 30-minute show.
I actually want to talk about something because this, when we plan these things, it's a long time ago.
Yes.
And I sometimes forget, what are we doing here?
Okay.
And just this week, I had dinner with a colleague who is a very prominent leader in the university.
Right.
So has a very important role in running the university. And we had a lengthy conversation because she really wanted to know from me. She said, what is going on with youth? The mental health thing, like what's happening? Because it's a puzzle for her.
Yes.
And in her faculty, it's important. It's important in any faculty, but it has to do with performance of these kids in sports and whatnot.
Right.
And so it was really interesting to me. She had a number of stories about young kids really falling off the edge,
Yes.
not doing well. She works with me on sleep research and whatnot,
Right.
so she understands that. But she said, what's the mental health thing? I said, oh, well, you got to watch our podcast.
Yes.
But it was really interesting because it speaks to this whole issue of what are we missing here? And we both came to the same conclusion from different directions that leadership is lacking.
Okay.
And the idea of KIDA, the bowing and respect for each other, to me is fascinating.
Yes.
So this is, I think, in the broader context of, the 6 faulty thinking,
Yes.
we need to acknowledge that we're not always right.
Yes.
And we need to acknowledge that there has to be some degree of leadership that takes into account mutual respect.
Right. Absolutely.
And without that, if I may,
Yep.
there is a vacuum. And the vacuum allows for poor leadership. I don't want to make any comments or names. I don't want to, point anything out, politicians or anything.
Right.
But we've got more than enough examples.
Yes. You're not referring to me. I mean, I'm doing
I thought you were
doing my
going to say
best.
someone's name.
No, I would never do that.
No, but I mean, we have these examples. And then we have the reinforcement, because I had to really acknowledge the issue of technology, social media, et cetera, and how it sort of amps up all of these factors. The faulty thinking is actually exacerbated. Is that too big a word? No. It's made worse by social media.
Yes, and I really take your point in terms of leadership, that people want to collaborate and are willing to acknowledge expertise, but the teacher is bowing towards the student and paying them respect, which is probably where it starts. And that allows, and that respect is, we want to know your story. And then the leader can guide or provide expertise in collaboration with the other person's story.
Yeah, and I think when I say in our generation, it was one way.
Yes.
Right. But we came out of that with a sense of discipline. Right or wrong.
Yeah.
Lots of bad things go on when there's a one-way relationship.
Yes, exactly.
But there is a certain degree of discipline that comes out of it.
Yes.
Without mutual respect necessarily.
Yes.
And I think You know, this is one of the things we as, you know, humanity should be proud of, that we
Yes.
are progressing to this place where there is mutual respect, and where I see it, and I know you're the same because I see the patients that come back that have seen you, is that sense of, he listened to me. I've never seen a doctor or psychiatrist who just listened to me. That alone gives them a sense of being respected. Like, that's
Yes.
actually a measure of respect.
Yes.
And so the bowing is a physical
Yes. Yes.
demonstration of respect. So my point then, Chris, is this, that one, I will have patients say, you know, you listened to me,
Right.
but I had to learn. And I think we're not taught in medical school truly to actually listen to the patient. We're taught to get to a diagnosis,
Right.
right or wrong.
Yes.
Because I actually will say to a patient, look, you know, the surgeon isn't there to be a nice guy.
Yes.
You want them to do a good job.
Yes.
And it's my job to, you know, help you out if I'm
Yes.
a family doctor or whatever. So the thing is, our training leads to a certain nature of relationship that
Right.
doesn't allow necessarily for what we're talking about.
Exactly. Yes.
So I think that that's important. Yeah, so let's get back to the 3 or 6 concepts, and let's just start with stories versus statistics. Give us an example of where that's important, and why is it faulty thinking? Like,
Yes. Well, if you look at a magazine, you consult people that have expertise, they can say, this is the safest car to buy, this is the best car to buy, all these factors, costs, etc. And if on the way to the car dealership, you run into your friend, and your friend tells you that she or he bought this car and had nothing but trouble with it.
Right. Same car that was
It's the
highly
same,
ranked.
yes,
Yeah.
highly ranked. It's very hard to buy that car, even though the statistics
Speak
are
well of
more
it.
Yeah, exactly.
So I find that every day in clinic, when you're talking to someone about a diagnosis, let me give an example. I'm saying to Mr. Smith, you have severe sleep apnea. Here are the risks. This is pretty straightforward.
Yes.
Yeah, but doc, you know, my friend had that too, and he tried that machine or that treatment, didn't like it, so, you know, I'm going to have to pass.
Right.
And I go, okay, how do I deal with this? Because the facts are the facts.
Yes.
And he might have presented with high blood pressure, prior heart attack, you know, diabetes. It's like, you got to treat this.
Yes.
But he is dead set on not treating it because of his neighbor or his buddy who said, that was the worst thing I ever did in my life. And so you have an uphill
Yes,
battle
absolutely.
to get them towards treatment.
Yes. Yes.
And so, okay, so that would be the stories versus the facts
Yeah.
versus the experience.
And it would be a common experience using a CPAP machine because it requires adjustment and adaptation,
Right.
getting used to it.
Right.
And the idea of using it on the first night or the...
It's horrific.
Yes, it's
And
terrible.
I'll just say to people, look, this is going to bed with scuba gear on. You're going to have to be patient.
Yes.
And yeah, okay, so that's really
But
good.
it'll have a good outcome,
We hope.
usually.
So appreciation of the concept of chance versus coincidence. So, you know, again, you have to help us understand
Okay.
what you're saying.
When you look at, if you don't take into account coincidence, you're missing out on the possibility that something that is important. When I first was in practice, I would prescribe, let's say, a medication or type of psychotherapy, and the person seemed to be getting better, but maybe not making as much progress, and they would announce, what happened recently, since I've been feeling better, is that my aunt visited and we had a struggle in the family, but we've patched things up. And initially, I would think, well, that's nice to say that, but it was probably this. As I've grown with experience, realizing how important those factors are
In the progress of the
in the
patient's-
progress
yeah.
of the patient.
May or may not be related to the medication or treatment that you prescribed.
Exactly.
And often, well, less so in your field, maybe more so in ours, we don't dig those things up.
Yes.
So we don't know what the background is.
Exactly. It's having the time to listen. And
get the story.
exactly, and not be dismissive.
Got it. Okay. And now you say chance versus coincidence or chance and coincidence? Are these different?
Yeah. Well, a chance is, anything could happen, and probably, but it always has to be taken into account, whether it's chance or coincidence.
Okay.
I would see
Either
them
way.
the same way.
Okay,
Yes,
got
exactly.
it. Okay. So on the last one now, Chris, is oversimplification. So give us an example of, how oversimplification expresses itself and is, in a sense, faulty thinking.
Well, it's the example I would use is marijuana. That there's so much acceptance of natural treatments,
Right.
understandably, and they all have some merit, but it doesn't mean that the marijuana is going to solve the problem. And my thoughts are always, if the marijuana was solving the problem,
You
I
wouldn't
would
be
ask,
sitting
why
here.
why are you sitting in front of me?
So I think this is really important. Obviously, it's funny to me.
Yeah.
But you bring up a really important thing. And that is truly the oversimplification of the idea that cannabis products in any formulation can fix this, that, or the other thing, or all the things that non-medically trained salespeople are telling patients.
Yes.
So this is not to dismiss people who use cannabis products successfully and happily in their lives. It's to say, we see the negative consequences.
Yes.
And they're bad.
Yes.
So I would like you to speak to some of the bad things that
Right.
you see, because I can speak to the ones I see. So
Yeah, it's a very good point. There are two parts of cannabis. One is THC, and the other is CBD. And CBD it's not toxic to your heart or your brain, but THC is. And so we would see patients in the emergency room where we would do a blood test to see what drug might be here, drugs of abuse or whatever. And we would have nights in emergency where it was only marijuana.
what were the symptoms? How are they presenting?
Oh, the hallucinations.
Okay, so they can become psychotic
Absolutely.
as a consequence of these drugs.
Exactly.
And that's my point, is that I will see people with desperate sleep problems that they attempted to treat with over-the-counter cannabis products, whatever, THC, CBD, combination CBN. And, they end up in emerge because they have severe anxiety attacks.
Right.
And this is directly related to the cannabis. And so to me, this is a problem with the whole cannabis story. And it is very oversimplified because there's literally no evidence that any formulation treats a sleep problem.
Right.
We'll get it.
Yeah.
It will come in the next 10, 15 years.
Exactly.
But we don't know now. But it's ubiquitous. It's out there. It's everywhere, and people are using it. So okay, that's one. From my perspective, when you brought all of this up, and I think it's so important for all of us to think about our faulty thinking. Like, where am I oversimplifying, or making things simpler than they should be, and listening to stories when maybe I should look at the facts.
Yes.
to me, social media is actually a big problem.
It's a very, very big problem.
Every format simplifies things and concepts that are far more complex. And in healthcare, this to me is very frustrating.
It's very frustrating, and there's studies have been done that in younger women, the suicide rates have increased, and during those increases all arose when there was affordable smartphones, then moving into, of course, the internet and social media. And there's been a steady rise in young girls, young women's suicides. And during COVID, one would anticipate it was worse, but it wasn't.
Oh.
It didn't. The influence is social media, that we've at least, I think we are confident that that is having an effect.
Yeah.
And people that work in social media, the owners of these companies, have been confronted recently on they need to do more because they're not really making a difference.
Yeah, and I say, we see the consequence in terms of sleep for sure, and then also in obesity, because the use of technology has substantially reduced younger people's and adults' activity levels. Substantially. And the oversimplification of exercise on the internet and or cell phones, is a misleading concept to sustainable behavior change, which is what we really need to improve the health of the population. So I think they're good for information, for awareness, but as general tools to help people to be healthy, I think we have to be very careful about that.
I agree, but I would say at the same time, you had said we don't know enough. So until then, we have to be cautious.
We have to be cautious,
and it's not rejecting or not respecting what other people think.
Yeah.
It's taking into account we need the evidence.
Right. Okay, so this is it. I think we've had a really good discussion about this idea of faulty thinking. So what's the homework that you have for folks?
Well, the homework I have is a message from Socrates, and that was, the unexamined life is not worth living.
Wow. Okay, so you're challenging people to do what?
To be thinking about what's going on in their thinking, in their feelings, in their behavior.
Okay.
And also, that's the role of therapists or psychiatrists, but it's also the role of a person contemplating what's going on. Right.
Yeah, and I would say to lead out of that and sort of reinforce that, because I think it's important. If you're wanting to understand faulty thinking, it would be important to walk away from here and challenge something you hold very close. A thought you think is, this is right, this is, whatever it is, and then just challenge your belief about that thought.
Yes.
Go to the other side, have a debate with yourself, and it may open a door to sort of see what faulty thinking is, and I think that's really important. Or listen to someone carefully you do not agree with, which is always very difficult for us. So, find someone who has a view about something that's very contrary to yours, and just listen to them explain why they believe what they believe. That opens a door to understanding potential faulty thinking or reinforcing that you believe what you think. So that's it. Season 2 is over. Kind of sad.
It's been a pleasure. We're moving on, and it's been great. Thank you.
Good. So,
and thank you.
Get your head to bed.
Get your head to bed.
Good.